And then, okay, great. And then I will go through some of this also, like at the end, I have some resources that people can use. We're going to look, of course, at the service design process and see what it looks at different kind of parts of the organization, the front end, the back end, the admin side, all of these parts of what's happening in service design. So we just want to get started here. It's probably a good time to start the recording. So, you know, oftentimes services are created in silos and experienced in bits and pieces, because here it says, Andy Pillane says, because services comprise multiple touch points across multiple channels and are experienced in their totality. So as a person, we go through services and we experience them as one thing, right? When I get accepted to UNBC, all the different services that need to interact with me, I see them as UNBC. And internally, they may be something entirely different. And so it's really important to kind of break through those silos to make sure you're understanding the whole experience that's being happened from the moment kind of that the service starts and right through. So often each bit of the service is in itself well designed, but the service itself has not been designed and does not hang together as a whole. And one like great example of that here in Finland is that there is no student housing that is owned by the universities. So no university owns student housing here. But as a student that's coming here from overseas, when I get student housing, I attach that to the university. So the university needs to care how my experience is with student housing, even though it has nothing to do with it. It's a private organization. The student unions usually are dealing with this. They own a lot of the housing in Finland. Student unions in Finland are fairly wealthy organizations, and they own entire buildings and they rent out to students. And so there are other social organizations that have student housing as well. So making sure that you are understanding the whole process going into a service that somebody sees as a customer is really important. The last time I was in Prince George in March for the Global Service Jam, my best friend there, her mother had to go into hospital, right? So we were driving to and from the hospital and trying, you know, finding parking. There's terrible snow, and all of that is, you know, how do you then, you know, paying for the parking and making sure you have enough parking, right? All of that is part of the process of actually going to the hospital. It may not be what the main function of the hospital is, but it is definitely part of that experience that someone will have. So, right, understanding that things are experienced as wholes, whether they're built in bits or not. So it's a perspective. And so, you know, what is a service? So many times when you talk to people and you're introducing them to service design, the first thing they think of is customer service, right? It's when you have a problem and then you need to get a problem fixed. Yet, you know, services in service design is defined, you know, one definition is here from Lou Downs, which is a service is something that helps someone do something. So, and it's as broad as that. So, like I said, it might be how I pay for the parking at the hospital. It might be how I make a doctor's appointment. It might be how the hospital contacts me for some specialist appointment. Like, do I get a letter? Is it a text message? Like, all of these things are services. How my utility bill arrives at my house or in my email. What is in my utility bill? What are you telling me on my electricity bill? What information are you going to give me? How much information is enough? How much is too much? How much will confuse me? Like, understanding all of these, that is all a part of the service that's being offered. So online grocery orders, bill payments, holiday, vacation, you know, delivering babies, house moves, all of these things comprise multiple services. And so, there's lots of services that are happening everywhere, all over the world. This is, we talk about how, um, you know, we've moved from the manufacturing, um, this kind of like goods dominant logic. So the you kind of like manufacturing economy to a service economy where 80% or upwards of our economy is based on services. And so when you look at, so I have my cell phone, right? So this, I bought this, but without any services, it's useless. I don't know, maybe I could use a calculator on it, but even that is still an app that's on my phone. It's still a service that's connected to it. We don't really buy, there aren't so many things that we buy anymore that aren't governed by the services that they offer. We're not necessarily buying the goods themselves, we're buying what the goods, what services are attached to those. So kind of having this very broad view of what a service is and how we design that, and how we think about them and how we value them and purposefully make them usable and enjoyable and useful, most importantly, useful. So it's really important that we take this kind of view of what a service is, and they can be also internal services. So, it's a service that the company you work for, the organization you work for pays you, and how smoothly that process goes. And if you do need to make a correction, what is that process? That is also a service. To correct something is a service. The city of Helsinki has had a kind of mini scandal going on now for months, in which people are their staff members. They are a huge organization. They have 40,000 staff members, the city of Helsinki, and they upgraded their like HR salary system. And still, months and months and months later, there are people who are not being properly paid from that system. This is a service gone terribly wrong. And it's how these kind of IT integrations can go wrong when possibly you haven't considered all of the different stakeholders that are necessary in that process. So it's just really important to understand that all of these things are services that are offered to us. And we in response, we are probably offering services to other people as well. And so it goes back and forth. And of course, we always remember those services that go terrible, right? We all have terrible service. A lot of them are referring to airlines. Those are some pretty terrible services. But yeah, how you check in for your flight is a service. How you receive your luggage at the end of that flight is a service. And so all of these processes can and should be designed. They shouldn't just be like, well, it's easiest for us as an organization to do this, and here you go. That's what you get. Because that will just lead to more work later on. And so, right, in further kind of service design is the process of adapting an organization's resources, its structures, and its services to exceed customer expectations and needs. And so a lot of when service design is done correctly, when it is done with intentionality, when people who should be included in the process are included in the process, it can be quite easy to meet the needs of those users. So whether the users are customers or whether they are non-paying users, or the different stakeholders that need different things from that service, it's really important that in order to have it well designed, that you have all those perspectives, because without that, somebody will always need something more from that service. And when you're doing this designing and when you're including people, it is a natural process of getting rid of things that are not needed, that are waste, that are they waste resources, and whether those are human resources, whether those are financial resources. So it's really important that you're kind of using the whole process to adapt the organization's structures and services to make them the most valuable that they can be. So one of the things I wanted to show you here is, so this Nielsen Norman group, they're really looking at both sides of it. So service design improves the experience of both the user and the employee by designing, aligning, and optimizing an organization's operations to better support customer journeys. And a great example here in Finland of this is, so the early education unit of Helsinki City. So when you want to put your child in daycare, all the daycares here are government run. There are very few private daycares, and if they are, they're usually kind of some kind of very specialist daycare, and they still need to be approved by the city government. And so here, what happened was people were finding the instructions on their website quite confusing of when they should apply, how do they choose the daycare they want their child to go to, all of these things. And so they did this massive redesign of their website. And so what they took down the numbers before. So the previous year, they had received over 6,000 inquiries by phone to help people get through the information and understand how the process goes for signing their child up for early childhood education. And that's probably that's like 1-year-old to 6-year-old, so preschool and daycare. And so they did a redesign using service design. So they had a service design team in the education unit, and their job was to even just redesign this one page, because they were getting so many service calls. And in the last numbers that I heard was that they had reduced this number of incoming calls to about 500 in the previous year. So the amount of, just by understanding, doing the research and understanding what it was that the parents were looking for, how they needed it to be said, and how they received that information, they were able to reduce the number of incoming calls and the people necessary to be at the phones and use their work time to answer those questions, from 6,000 inquiries to 500. And so this is kind of the process of making sure that you're optimizing the user experience, but also the employee experience. You need to understand what's happening in their world, how they're being disturbed by these calls, and how unnecessary they think it is, and that they're giving the same kind of information out again and again. But since they don't have access to the website, they can't change the content that's in there. And of course, and you also don't want 1,000 people in an organization with access to the website to change the content. So you need to kind of make sure that the content that's there is really useful for those who are actually using it. So I want to stop for a second and see if there's any questions, or I don't have, I can't see the chat if there's any questions, unfortunately. So if there's nothing.
There's nothing in the chat for now,
Okay,
but I will read it if people send stuff through.
perfect. Thank you. All right, so because we've kind of talked around service design and kind of why we would use it and why it's important and how it will help us. So basically, what is service design? And I would call it like organizational development. And for me, it's made up of 3 parts that need to be kind of taken on board. So the first part is the mindset, right? This is human-centered design. This means that you need to see a problem, and the first instinct is, let's find out more about the problem. That is the mindset of service design. Oftentimes, as human beings, we go, oh, there's a problem. I think this will fix it, right? And so it's a very naturally human thing to do that, to be like open and wanting to jump on a solution right away. But it's often the case that you're seeing one part of the problem. Maybe you're seeing the outcome of the problem and you're not actually addressing the real problem. And without doing that kind of exploration, without doing your, human-centered research and really talking to people who are having the problem and people who are affected by the problem. So talking to the people who are receiving those phone calls in the early childhood education unit, and then talking to some of the parents out there who are having the problem, without getting all of these sides of it, you could just be kind of trying to solve one little piece of a problem, or even just you've made an assumption, but that's not really the problem. So the mindset is really, really important to start with, opening up about how you would approach a problem that comes up. And the second part is the actual process of service design. And that, as it says here, is the design thinking process. So service design is the application of the design thinking process to services, and it doesn't matter, like I said, it doesn't matter if they're free services, if they're paid for services, if it's a private organization or a public organization, the process in itself is the same. And then there's also the tools, the toolkit that you will use, how you will go through the process, how you decide what kind of research you'll do, how you decide who to include in the different parts of it. So we'll go through that. And so I wanted to start a little bit with the mindset. So how you approach problems. So there are many different ways that people begin to solve problems. You often hear, the quote, don't bring me problems, bring me solutions." So, service design is, don't bring solutions. Bring me a problem that you've identified, but also a plan on how you're going to find out more about that problem. Who needs to be involved in that? So, instead of jumping straight to a solution, which feels good, it feels like you're doing something good, but oftentimes we have a saying in service design that you end up doing the wrong thing righter, right? Because you don't know that's the what the problem is, but you think you know what the problem is, so you'll work on that problem, and that you might get it might get better, but it might still be the wrong problem that you're trying to solve. Maybe it's just part of the problem. So this is where we start to look at what the design thinking process is. So we have this, some people use the Design Council Double Diamond. I that's a very good process. It's much more, I would say, demonstrative in the way it's drawn. I like this one because I like the 5 pieces. So the design Double Diamond has 4 pieces to it, but sometimes I get a little lost in the middle how I'm supposed to describe it. But here, this is the Stanford Design School process. So we have these 5. So empathize, define, ideate, prototype, and test. And very much your research is all about learning about your audience. You're using empathy to kind of move through the problems that you're having, and understanding the problem, and understanding who's having the problem, and understanding when the problem comes up and what is the effect of that problem. What are people having to deal with because of that problem? And once you have that context, it's really much easier to understand whose problem you're solving, and what are some possible ways of moving forward. So when we have this empathize, this is, when we talk about tools, this is where you go and you do your interviews, you interview people. We have the quantitative and qualitative data gathering. Quantitative you can put out a survey. So the quantitative data will tell you what your problem is, right? So it will tell you that um, X number of people, like 7% of people get lost on the way from the front door to the floor or the unit they're supposed to go to in the hospital, right? That will tell you that number. That's what quantitative data will give you. But it won't tell you why they get lost, right? So that's when you need to go to your qualitative data and doing the interviews and figuring out what's the confusing part. You know, it might be that the confusing part is the letter they received. It might be the stickers on the walls or the floors. It might be that somebody gave them incorrect information near the door. So there's all of these things. So if you don't know what the problem is, you might fix one of those things, and for a few more people it might help, but you're fixing the wrong thing righter. You're getting a little bit of movement forward, but until you understand why, the different reasons why people are not making it to the right place, you will not be able to really fix the problem that's happening. And so, once you have this idea of where the gaps in your service are, or where the very bad, like sad smiley faces are, I don't know, can you call it a smiley face if it's sad? So if your sad emoji is coming up a lot when if you have those kind of, I don't know if the company here is happy or not, that where you press the buttons as you leave a service or a place of business or wherever it is, it helps you to know that people are unhappy with the service. But until you actually do the empathizing and meet up with people and ask them, to talk about it, you won't find out why. And the context and the why. You can't fix a what, but you can fix a why. This is the difference. You can't fix something that you don't understand properly. And so, once you have this understanding, like, okay, the problem is happening in this area. The problem is happening when the people get to the front door and they don't know that the unit is this different unit and this different unit. They have quite similar names, maybe, but you, as the person who works there, knows the difference very well. So you might be, some people might be calling it, like in the university context, some people might be calling it the admissions office, and some people are calling it the registrar's office, right? And so understanding what's on the wall and how people are talking is really important so that they can figure out where it is that they're going and who they need to talk to. And so that's when you get to the define process. And in there, this is where, you're now dealing with very specific problems that you are starting to understand. So you're defining what the problem is that you're going to solve in this process. You'll need to, pick a problem that you're gonna solve. And then through that, you're gonna start, ideating with people in a controlled manner how you're going to fix that. And so, as you can see, we're already in the third, you know, part of the process, phase of this process, and we still haven't thought of any ideas on how to solve the problem. And this is the biggest challenge with the design thinking process, because we are problem solvers. We love solving problems. We love making sure that we can move forward quickly. But here we're halfway through the process and we haven't asked for one solution yet. We just really need to understand what the problem is. And the way we do this is we begin, when we have a clearer idea of where the problem is happening, we start asking before we ideate these how might we questions. So I'm going to go forward and then come back. So I've written out some how might we questions. So when we're going to start ideating around a problem, you need to have a really good, tight how might we question. So here, one that my friend who works for the city of Helsinki, this is one they're working on right now. How might we get 17-year-olds to start making their own dental appointments, right? So they really want the young people to start taking control of of doing these things to, help them kind of to get into being an adult and being responsible for these kinds of things. So that's their current issue, that one of the things that they're looking at. So they're out there interviewing, going into high schools, talking to young people, finding out what their lives are like, who makes these decisions, who makes the appointments, and then they'll start looking at how they might be able to encourage 17-year-olds to start making their own appointments. And so I basically, I follow the Prince George Facebook page. And so I know there's lots of stuff that goes out there about the bears eating the garbage. So, right? So how might we encourage citizens to be more bear aware with their garbage? That's a problem that they might want to start, kind of ideating around. And I just made up a bunch of these. How might we allow nurses to be more strategic in the changes that they make on the wards? Many times from the nurses I've talked to, they make changes for when they're on shift, but they don't get passed down to the next people. And so they're kind of short-lived, or only when a certain person's on are these, problems recognized and dealt with. Or how might we encourage more creative actions from administrative staff? That's could be in any organization. One issue in Finland with the Red Cross Blood Services, they want to help encourage so more blood donations from young men, right? That's where they're seeing a problem, is they have a very low blood donation from young males. And so they want to be able to encourage them to be more proactive in that. So that's a problem they're dealing with. And how might we help Prince George residents understand where their property taxes go? If people are calling in and complaining like there's this problem and that problem, and I pay you all this money, right? So this is an issue that might be, taken on at City Hall. So, how might we improve the patient's experience in the waiting room? So this was actually, I saw this one online, and it was obviously from an American source, because the original one was, how might we improve the patient's experience in the waiting room so we can enhance their overall satisfaction and increase the number of return visits? So I think in the Canadian system, we would like to help reduce the number of return visits, right? So I thought that was funny. So I took out that end bit, because I don't think we want to increase the number of visits by people in the healthcare system. And and also, how might we improve the interaction between doctors and patients so that a return visit isn't necessary, right? Sometimes information isn't remembered, or there might be something that you can kind of ideate around that to see, just so that people aren't calling back and say, oh, what was it that you said about this or that? Or so there's all these different ways to be looking at the services. But this is the ideation section. We create these how might we questions because we have this phrase, how might we. How just means like, we're all in this, we're working on this problem, and this is what we're trying to solve. And then the might part of the problem, of the question, is just, there are multiple answers to this question. Let's get them all out there. There isn't just one that we're going to see. And the we part is that we're going to do this together. It isn't just one person's decision on what we're going to do, what we're going to move forward with. We're going to create this kind of co-creation session where we're going to, try to get out all the ideas that we can think of to address the question that we've come up with. And so we go back here to this. So we've done the ideation, we start the brainstorming, we start creating solutions, where there are ways where you can assess the solutions that you've come up with, depending on, you can come up with a matrix, you can decide what it is that's important. Is it time and impact? Is it money and impact? Is it money and time? Like, what are your kind of like, what's a success for you? And you can create the matrix, and you can start putting your ideas, the individual ideas that you have within the matrix, and seeing what it is that you might want to start prototyping. And so then you move on to the prototyping part of the process, and then you start to build representations of one or possibly two or three of the ideas that you've come up with, and just see in a very, very simple way how you might test those, right? So it's really important. It's really important not to invest almost any money in the prototyping part of this. So even if you're coming up with something digital, there are ways to make digital, what I call dumb prototypes. They don't have backends to them, but you can test the flow of the screens that you have. You can test the language that you have in them. There's all those ways to do that. You can build cardboard representations of waiting rooms, of offices, of anything that you need to prototype that's a physical space. You can do that in cardboard. You can do it in Lego. All of these different ways are the very first way to prototype your ideas, so that it's quick, it's inexpensive, and you get answers pretty easily. And so then, once you've built your prototype, then you go on and test it. And it's quite possible, like that was, a total dud. That's no problem, because it's just learning. You're just learning that that's one thing that didn't work. So we'll go back. Maybe we have to go back to the ideation part. Maybe we need a few more ideas. Maybe now we have more information about what they're expecting, what they're not expecting, and then we can prototype again and test again quickly. And so you're kind of moving through this process, not necessarily in a linear way, but you're kind of hopping back and forth and always trying to prototype and test until you have something that you can implement. So that was a very quick explanation of the design thinking process. So for now, is there any questions? Anybody want to make a comment? Anything where I can stop talking for a minute?
I have a question.
Yes.
I don't, it might be jumping too far ahead, but like, who is the responsible person when you're going through that? Is it like assumed to be the service owner? Like, who's going to be accountable for the service?
In terms of who's involved, always, right? It's
Yeah.
always got to be those who are going to be delivering it and also using it, but also the people who pay the bills that come in. That's very
Yeah.
important that they're the ones that are included in it. In terms of the process, some people, some organizations like to bring in an outside person to facilitate it, but there still has to be an
Okay.
owner of it. Um,
Gotcha.
or sometimes, again, my colleague that works at the city of Helsinki, they are a very small team in the education unit, and they are basically like farmed out to different product owners and different process owners. And so they work on projects. You develop a project with the product or process owner, and they work together. So the service designer is there to guide the process, but ultimately the decisions need to be made with the team that is doing the process. Anything else? Okay. So here it was, I think it was about 2 years ago now. The US created this state of service design in the US report. And it's very interesting to see comparing it to where we are in Finland. But they talked about service design strategists in organizations, right? So looking at the lens that they apply, because of course, if you're doing it on a strategy level, they're also focusing on maximizing the business potential of a service, looking at the positioning, cost efficiency, resources, and how service design will shape the experience and touch points that manifest for the user, and also like the user can also be considered those internal, and orchestrate the interactions and validate via testing. So there's the two parts of it. There's the strategic use of service design, looking to these kind of broader business points, And then there's the, like the application of the service design and how they're using that within an organization. And it's, so really important to have this, to understand that these things are connected. And it's really important that customer satisfaction leads to business success, like understanding the connection between those two things, understanding that the services need to be feasible and viable and desirable, this, what they call the design balance. So that's, when you're creating a new service, is it feasible for the organization? Do we have the expertise here to put this forward? Is it viable? Do we have the money to actually make this happen? And do people want it? Right? If you can't answer those three in the positive, then it's not the right service for your organization, and you have to kind of go back and work on it. And so what this actually looks like in the organization, so there's this great visual representation. So you have here at the front this kind of front stage. Well, there's like where the actual customer's interacting with what's happening. And the front stage is where you are actually presenting this service to your users, to your customers, right? So you're there. It's the receptionist as they walk in. Yeah, Rochelle, you can ask, yeah?
Okay. Sorry, I was wondering, like in your service design, this picture is great, by the way. Like, how do you mitigate the risk where what you're problem solving and the service you're trying to design all of a sudden becomes irrelevant? Like, it's either a cause of like the environment's changing so fast, or the teams can't work fast enough collaboratively together. So by the time you've like gotten to the point where you've done your service design and you've done all the work and you have your product, it's now just entirely irrelevant. Either something's changed that makes this no longer a problem, or the service needs to change or adapt to like. So I guess so the question is like, how do you mitigate that risk? Like if the support processes in the backstage are slow, the truck is late, the boxes didn't show up, but the customer journey and like some of their needs are still there. Like how do you mitigate those kind of risks?
I think, well, service design isn't one of those things where you do it, you kind of, you do the research and then that's it, right?
Yeah.
You'll be finding out that either your service is not needed when you're, heading into the testing or even in the implementation, and then you need to go back. You need to, it's an ongoing process. It's continuous improvement, right? That's what service design is. It's continuous improvement. It isn't something that you do once and then it's done, because, you'll have COVID, right? Boom, everything changes. So now you have to do a different kind of research.
Okay, that makes more sense.
Yeah. So, and of course you'll have, I'm just trying to think, what are some of the things that changed quite instantly? Even allowing people to work from home, right?
Mhm.
That changed businesses. That changed how they did things. My ex-husband was always told, he works here in Finland for the tax authority. They were always told they couldn't work from home. The systems wouldn't allow it. Do you know how fast the systems allowed it?
Quite
when,
quickly.
when COVID came along, exactly. All of a sudden, right? It's a thing now. And so, things do change and things happen. And sometimes they're fast and sometimes they're slow. And sometimes you just see, what are called weak signals of things happening. And they are kind of like the early warning signs that something else is going to change. So yeah, so here you can see, the customers coming in for this play, they're going to interact with the ticket office. They're going to buy a ticket or show a ticket. They're going to find their seat. They're going to do all those things. And then in the front stage, you've got the people preparing the stage for the event that's going to happen. And backstage, you have all the different parts that are coming together. And all of these work for an organization. In the backstage part, you've got the different IT systems that are at play. When I want to book an appointment for something, there are IT systems that need to come into play. They need to connect with calendars. They need to do all of these things in the back. That's the backstage that's happening. There are people that are involved in the process that I, as a user, or customer will never see and I will never know. And, making sure that these things are all being seen from the organization, that they're understanding that these things need to play nice together and they need to work. And then you have the support processes, the really kind of fundamental things that, if the electricity doesn't turn on, then nobody's making an appointment for anything. So, like you said, the boxes are arriving, the food service is arriving to, the campus to fill up the cafeteria. All of these things, all of these different parts of the process need to happen so that you can go have your lunch at lunchtime. There's all these different services. So one of the things that we specifically wanted to talk about here was service design and lean. And I don't know, is that maybe a bit too small? I don't know if I can make it bigger for you. So basically this goes back to doing the wrong thing righter, right? When a problem is seen and you jump to a solution, you're very likely going to do the wrong thing righter. It might be streamlined. You might get rid of some waste from that process, but whether that was the right process in the first place is the question, right? Understanding the real problem by investing in the right early stage research can help eliminate waste naturally. Service design, a byproduct of service design is eliminating waste, because I'm not going to do something that doesn't add to the customer experience. I'm not going to do something that doesn't increase the satisfaction of the user. And so anything that doesn't contribute to that, I no longer need to do. So here, this is not my table. I took this from there's a link at the bottom there from this design organization, Snook. I think they've just been purchased by a large consulting agency. This is what's happening to a lot of service design agencies. They're being taken in-house. So Capgemini has their own now, et cetera, all of these big organizations. So here, just looking at these few things here. So lean is very process driven, eliminating waste. Let's look at the process. Let's get the process to its optimal amount. So, and service design is about being experience driven. How is this service experienced, and what makes the most sense to actually create an experience that people want to use? And then we have, focused on reducing variation or reducing waste, and then versus gaining insights from the outlier. So it's important to know kind of what the edges of the problem are, and then designing for that. If usually when you're designing for the outliers, you're also designing for those people that are in between for the most part. Oh, I've got a spelling mistake there. Sometimes it is the generous gesture that wins and keeps customers. So if you are working for a private organization and keeping customers is really important for you, there are, some of us work in organizations where the customer has no choice. So it's still important to make sure that you keep them, satisfied and happy with the services that they are using. And one of the things that has come out with lean, with this and Six Sigma, this kind of like black belt and eliminating and these kinds of words, these kind of intimidating and confrontational language. Actually, I'll get back to that in a minute. So there's one article that is really interesting about this. So, and in service design, we're focusing on the positive experience and empathy for the user, and understanding the context of their experience and what language they use. So, it's again management driven, things done to the staff. We're going to change this process. We're going to move this along. We're going to do it like this, versus the not so design, but the co-design approach, things done with people. So these were, there are many ways in which lean and service design work together. right? So you can definitely use service design to get those initial insights, to figure out how you're going to eliminate waste, how you are going to reduce variation, and how you're going to focus and create something. So here they also talk about being focused on learning from the past and proven methods, where service design is very much about looking at what are some new possibilities, what are new ways we can do this, where we might have better outcomes, right? So I would say one of the difficulties of service design when you kind of like selling service design, so convincing people in organizations, you can be inside the same organization, is that you're selling the opportunity to fix the problem. You're not selling them a solution, right? We can come up with something to fix this problem. I don't know what that is because I'm not having the problem. We need to figure out those people who are having the problem and find out what the problem is. And then we'll come up with a solution. We'll come up with a creative way to solve this problem. And I think this is one of the reasons why these big consulting companies are starting to bring in service design agencies, because consulting agencies, they sell solutions, right? But service designers, we can't sell you a solution. I don't know what's going to work for your problem because your problem is distinctive to you, most likely, right? It depends on your context. What works in Vancouver isn't necessarily going to work in Prince George, or what works in Boston or New York or Helsinki, right? We need to find out in the Prince George context how this problem presents itself and how it might be fixed, how people there are willing to fix it. Maybe they're more or less likely to use a digital solution. I don't know. I can't tell you that. So we talk about in service design, we talk about the fuzzy front end. And that's just like the unknowing and being comfortable in the unknowing and being able to kind of push through this unknowing together and do your research and kind of come out the other end with some solid ideas of how you're going to move this forward. And so, you're thinking about this. So there's more this analytical thinking versus this intuition. Like, I feel there's a problem here. People are not happy. I've seen some of the data, but we need to figure out what it is in this data that people aren't happy with. And then they're talking about this reductionist approach, this siloing, this kind of like whittling down to this part of this service is a problem, so we need to fix this. Whereas in service design, you're like, okay, looking at it from end to end, where are we seeing that the satisfaction is dropping down? And then trying to figure out what it is in particular there and trying to make it all work together better. And then just this idea of like the, collaboration and the co-design versus the top-down management decisions, changing things, changing processes. So these are, how I can kind of explain how service design and lean, this is exactly how they're different, right? These are the different approaches that they're taking. But, oftentimes, people are using service design, the service design methods, especially the empathize and the ideate, like these parts of the process, to then, put in place to then work with lean in how you kind of move through to getting to your solution. And just to kind of move over, so this is a book and chapter. Of course, this is about higher education, but it's also, higher education is also this kind of same kind of public, similar public service. So chapter 8 of this book is called Exploration of the Relationship Between Lean and Service Design for Service Improvement. So this is a new book that's coming out soon. I know Kafui has ordered it. He says he has anyway. So there's a chapter in this book that I have co-written with somebody, but specifically for lean and service design, chapter 8 with Mila and Nicole. They have written about this, so it might be interesting for you guys to check out. And so this service design and practice, I just wanted to kind of show you So we did a survey here about, just as the US did the state of service design in the US, I did a state of service design in Finland report. And so we did this survey. And so these are the different job titles that people are using service design in their work, right? So of course there's lectures because people are teaching service design, but project managers, strategic designers, experience designers, business designers, citizen relations, even some software architects. These are the ones that came up: customer experience, behavioral science, visual graphic designers, development managers and insight managers, scrum masters. Like all of these people are, when we did this survey, we got, I think, 230 responses from people. So but only 48% have service design in their actual job title that are doing it. So for us, that was very interesting to see the breadth of people that are actually implementing service design in their organizations. And then we have here, this is the left side is the US one. So in which industries are people applying service design? And so I noticed that healthcare is the third highest there. So 34% of people are working in healthcare, but also, technology, financial services, nonprofits, government, and then it goes on and on down at the bottom there. And then the right side of this is how it's looking in Finland. So we did a survey that said, before you knew about service design, which industry did you work in? And then after you learned service design, what industry are you working in? And so that's the numbers on the edges there. So more people went into consulting and strategy, more people went into information and communication technology, but also more people went into government or community services. And then also, engineering, science and technology, healthcare, social innovation, banking. So just kind of having that and seeing what that is, but also what they are doing. So, why are you at your work? What are they expecting from you? So in the US on the left here, to increase user centricity of the organization, to improve customer satisfaction, to increase engagement, to improve employee satisfaction, reduce operational costs, increase revenue. And then again, the Finnish version here was, some of them were the same, but also, the third one there, facilitating innovation within organizations. That was a really big one for here, and also to guide strategic decision making. So a lot of them were similar, but it's, it's very much, it's more focused on the strategic level, I would say, in Finland than it is in the US. And there are many reasons for that. Within the education system, there are 33 degree programs in Finland that teach service design or are entirely focused on service design. The US has one. So, and Canada has 0, right? So, Finland has been doing this, and they're very much kind of at the forefront of this. So, it's taught at, I would say, 17 institutions in Finland. There aren't a whole lot. We only have 5.5 million people here, which is basically the size of BC, but it's a third of the size of BC, the actual country size, physical size. So, it's fairly small. Well, in Europe, they consider it very big, but in our context, it's very small, and so they're able to, and it's also a very, I don't know, very ordered society. So it's sometimes easy, and it's also it's a quite homogeneous society, which means that you come to consensus much quicker, easier, when you're, making changes and stuff. So there are like different reasons why that is and why it might be easier to implement things here, but by no stretch of the imagination is it impossible to do anywhere else. And I think one of the really interesting things here in this facilitating innovation is the broad concept of what is innovation. And Kafui and I have talked about this in the university context. and how, you know, Finland takes a very broad concept of what innovation is. It isn't just in the hard sciences, but it's in business, it's in processes, it's in all of these things, and innovation in all of those things is really important. And so some resources that I wanted to give you, I'm going to wrap up here very quickly, but here are some, their links. I will send the PowerPoint slides to you. And so I specifically put some healthcare ones in here. And so the first one, I believe some of them are just like simple blog posts. The first one is for Melbourne University in Australia. And it's also to kind of give you an understanding that this isn't something that's just happening in one place. It's happening kind of all over the world, and it's happening in healthcare a lot as well. The second one is kind of like a quintessential story of why designing services and why designing processes is really important. And this comes from one of the designers of the MRI machine that you have, and the experience that people have going into the MRI machine, and how he had to rethink how the experience of the machine that he was part responsible for creating impacted on young people, on children, when they had to use it, and how he had to kind of use design thinking to really think about the experience that people have in it. And then also the third one is a podcast where it's a US doctor of nursing, and she talks about how she has implemented within her team, using service design in her like front line nursing. But then also the next one is a Norwegian example of why hospitals need service design. So of course, there's the hospital side of healthcare, but there's also the administrative side and the back end. And then at the very bottom here, I put, while I live next to Helsinki, I live in a city called Espoo, and they have a concept called City as a Service, and it's how they implement kind of this participant citizenship, right? How they engage the citizenry to kind of help them develop services. And so they have a website, like part of their website is, it's available in English to read how they're engaging the citizens or the residents of the city to develop services there. And then finally, Global Gov Jam. I did add this here. And I don't, this is a link. And the one that we did that Annie spoke about, we did that back in March. And that was, it's a wonderful thing to be a part of. And it's really kind of baptism by fire. You come and you learn and you work and you create and you meet people and you have ideas, and you have this kind of, it's called like 48 hours to change the world kind of idea. It's not 48 hours that you're actually working, but it's over a period of 48 hours. And you can use that time to think about how services are felt and services are received, and how you might want to create a service if you had the opportunity to start from a secret theme that they reveal. So nobody comes knowing what they're going to do. Nobody comes part of a team. You get put into a team when you arrive. And we have there's a big theme reveal, and then you start working with your team on that theme. And it's tons of fun. It's hard work, but you learn so many things, and kind of like starts all those synapses in your brain firing. And I would really encourage you, if you want to come along, or if you want to really kind of understand that design thinking process, that you will be, my job there is to guide you through that step by step, and tell you what you should be doing at each stage, and how you might, ask you questions figure out your how might we questions, all of these things to move along. And so you get like a real good taste of what service design can do and how quickly you can go from no idea to something that you can test. So I have this. Thank you for your time. And I can stop sharing, and I would love to chat with you more about this. No, really, stop sharing. Have I stopped sharing?
Yep.
Great.
Yeah. Any questions?
See, let's see here. There's something in the chat.
Oh, just a question about presentation.
Yeah. No intimidation is used. Fantastic. I, I think it's more the language that can be intimidating for people, but not what you're trying to do or how you're trying to get them to no coercive behavior. But anyway,
So
and yes.
I thought I would just speak about the jam that I attended, and going back to sorry, I can't remember whose question it was, but like who owns the service design process if you were to bring up something to your organization. And one of the things that the Global Jam taught me was learning how to work around obstacles that might get put in your way. I was paired with someone who had sort of a whole different idea of what we were going to present for our service design. And we had to work together and figure out how to negotiate his ideas into my ideas. And so I think it's a really good experience because I can envision trying to go through Northern Health and you have this amazing idea and all the roadblocks you're going to hit. So, the jam actually helps you learn how to work around those roadblocks that you will probably hit in someplace like Northern Health.
Any other questions?
I appreciate that insight, Annie. Yeah, because it's the feedback both ways. It's the up and the down. So, the corporate clinical business, pushing it down to like the service providers inside of the organization, like IT, and then us moving it upwards in the chain and stuff.
It's huge.
It's a challenge. My only other question was for Kafui. Sorry, it was just on your course that you said that UNBC had for January. And sorry, I totally cut you off, Pamela.
No problem.
Mm-hmm. Oh, so what's the question? Just like
what course was the name of the course? You said in January there was a UNBC course.
Right. So it's COM 203 called service design. We need to get it on the schedule. But the way it will work is it will be partially an online course, and then we'll have workshops as well. So that will be in person. So I have been given an excellent overview of the course, and I haven't unfortunately had time yet to really dig into it. But yeah, the idea is to have that available in January. So we just need to schedule it.
Cool. Thanks.
Stacy, I believe, has their hand up.
Hi, Kafui. Nice to see you. Thanks for coordinating this. Just to follow up on that question, I'm curious how COM 203 might be accessible to working professionals who aren't engaged in the commerce program.
Yep. So because 203 is part of our, now I feel like I'm in an ad now. Because 203 is part of our business certificate, the idea is to make it accessible. So then the workshops would be scheduled for the evening, and in person, and online, we need to talk about the time difference because Pamela will be the one doing that. So I think we should have it. Well, there will be synchronous online parts of it, and I believe also asynchronous. So for the time difference, we can try to make it so that people can be done after, or can come in after work. So again, it hasn't been scheduled yet, but we'll try to make it so that more people can come in, because it is expected to be something that would attract people outside of the normal, quote unquote, um, undergraduate schedule.
So do people have to register then for the certificate, or sorry, apply for admission to the certificate, or they can just take this as a standalone course?
They could take it as a standalone course. Yeah.
Okay.
Absolutely. Any other questions? In the chat.
One thing I'm wondering about is for the people at the Hubspace team is how do you see this can be, you know, useful for the work that you do?
Mm-hmm.
Does anyone else on the team want to take this?
I can certainly see a usefulness to this. We have a program right now that is provincial in scope, and it's also a hybrid program in its delivery. So given that there's a lot of different ways that the sales funnel begins all the way through to the program being completed, whether it's virtual or in person, and the way that these people are coming into contact with us, and the way that they're getting the right information at the right time, all of that, all of those pieces are things that we can certainly use service design to consider. And even within I had the privilege of working a little with Pamela in the past, with the past project I did. So part of the curriculum that we use in the program, we do an exercise where it's a process flow, but we color code it. So everything that the entrepreneur is doing that is customer facing and engaging their customer is a different color. And at the end of that process, we show them these are all of the opportunities that you have in your constant operations where you can go above and beyond and focus on the customer. We talk about that more in the context of that's what sales is, as opposed to, you know, the greasy car salesman, but it is service design, and it's really fascinating, and it's neat to learn more about and to include in that.
Yeah. And for sure, you know, service design, when you look at its origins are in services marketing, and really, you know, understanding how it has developed into its own thing. But, you know, it was really about understanding your customer, how you talk to your customer, how you make them understand what the value of what you're offering is, and all of these things. So it very much is in there, and it's just it's developed more into kind of all the other things that go into delivering the service, right? So not just the marketing part of it, but how do you make the experience seamless for them, because that they don't care. They do not care that that's a different department, right? Nobody cares.
Yeah.
I want, you know, this is the outcome I'm looking for, and I was told to come to this building.
Right.
I don't care how you guys work it out in the back, but this is what I've come here for. And so understanding that people don't care how your internal processes work and who's responsible, and it's not you, and it's not your unit, and all this stuff. When you understand that, you can begin to build the experience that people are expecting.
I think also that as a nonprofit economic development agency, it's also very important, and we can use service design to create some of the outcomes that we're looking for, because often we think of ourselves as only serving the entrepreneurs that we help to launch their businesses, but there are community partners, there are our funder who is really also our customer, and then we have to meet their needs, and trying to find how best that we do that, what is viable and what is doable. And so service design is a great way of thinking, and I love the idea of, you know, asking first, how can we find a solution rather than what is the solution? It's just a switch in your mindset of like what kind of processes or kind of detective work. Yeah, it sounds a lot more interesting. Like, let's just come up with something that we think will work.
Yeah. And it also helps to lessen this kind of like, there is no hero. You know, we're not looking for that one person to come up with that flawless idea. There is no flawless idea. You know, you will, any successful service has gone through many iterations before it actually meets the needs of people. And understanding that, you know, the beginning, the spark at the beginning is not what it's going to look like at the end is really important. And that way there are no heroes. Hierarchy doesn't matter. You know, you build on ideas that come out in a group setting in the co-creation. Is, I think, also really important to, you know, and it often helps, you know, the way you do service design, you know, we often talk about like brainstorming and there's, you know, a lot of verbalizing, but that also really only suits those people who are comfortable talking in groups, the ones who are the loudest, the, you know, but, you know, we don't do a lot of that in service design. We do more of what's called brain writing, right? Where people sit quietly, they use their Post-it notes for like one idea, and then they just keep adding ideas to an idea wall. And then at the end of it, we will take a look at all the different ideas that came out, and I won't know who came up with this idea or that idea. You know, there's a very specific reason why we hand everybody the same pen and the same color Post-it notes, because it doesn't matter who has the idea. It's not about the title you have when you go in the room. It's not about how loud your voice is or how confident you are. None of these things, you know, you try to strip away all of those things that help some and hinder others. And so you want it to be as inclusive as possible. Yeah. And also this idea of different stakeholders, right? You have, you know, we always use these stakeholder maps, which are these concentric circles. You know, you'll have some stakeholders that are much closer to the process, much closer to the service. And in that sense, maybe they're more important to understand, but it's just as important to understand, you know, who's going to be funding this? Why are they funding this? What outcomes are they looking for? And how do we make these work together? Because it is, you know, service design is a balance between, you know, the provider of the service and the user of the service. You know, this idea, you know, the customer is always right. No, the customer isn't always right. Our company can't necessarily make the service that they want us to make because it just suits them. We need to figure out what is viable, what is desirable, and what is feasible on a much bigger scale than an individual customer. So sometimes you have to say, you're not my customer. And you move on to, you know, you define who your customer is, because it isn't all, you know, it can't be everybody all the time.
Thanks, Pamela.
Any other questions?
Is there anybody who thinks that they can come? Because I'd love to, you know, see who to the Global Gov Jam in November.
Yeah, that would be great. Okay.
Rochelle, all the
I'm
L's.
good. All the L's.
Yeah.
I just have to get approval. I doubt it'll be an issue, but yeah, I'll be asking to go.
Mhm.
Yeah, it would be awesome.
I'll throw out there, I think I need a little more information to better identify how it will be relevant and who else from the team might see value in participating.
Mhm.
So
Yeah,
I did put my name in the link, but it doesn't have some of the details that you described Kafui, and
Oh, right. Yeah.
so if there's any kind of outline or objectives or that sort of thing that you could share with myself, and I'm seeing Bella nodding on the screen here as well. I think that would be helpful for us in Northern Health to determine what might be best suited in terms of who could participate.
Right. I mean, again, I can, yeah, for time constraints and other things that needs to be in there. But generally, there are maybe 3 things that you can get out of this. The first is a chance for you to use this in practice, basically. So then Annie had to leave, but when she was in the Global Gov Jam, she thought about service design. We had a webinar. She learned about it, and she's like, "Oh, it might be useful for my company." She then went through a process and was like, "Wow, I can see how to use this process in my organization." Right? So that's probably the first thing you get out of it. The second thing that you'd get out of it would be connections to other people. So there will be people, obviously from Northern Health. There are some people from UMBC who are interested, some people from the city as well. And so you can, especially in a context like this, healthcare is probably going to come up as one of the services that people think about, and you get to see different perspectives on that from outside healthcare. But then also with a focus on creating better services. And probably the third thing that you'd get out of this is the ability to learn it so that you can teach it in your or expose it to people in your organizations who are not who weren't there, or who didn't think originally that this would be useful for them. So then, because you're actually doing the work and getting the knowledge at the same time, you can start to see in other parts of your organization where this can become more and more useful. So those are the 3 main things I would get out of it. And if I was trying to sell this and hype this, just as actually Pamela pointed out, I'd love to tell you this will solve all your problems. It's the greatest solution ever. And unfortunately, I can't say that without lying to you. It is the ability for you to learn this process, which then can be used to find solutions in your organizations. And so if what Pamela was talking about, if what I've described as well, if you're thinking, hey, I think this might be of use to Northern Health, and I want to make sure that it is, then the Global Gov Jam is a perfect place to. The Gov Jam is a perfect place to be for that, because you get to essentially do a guided tour of how you would use this in your organization. So yeah, on the other hand, you're like, well, service design is not for me. I don't really think, like, will it solve all my problems? And I'm only going to come if that's the case. Then yeah, I can't. But what I can do is there is some material of previous Global Gov Jams. Again, it shows a little bit of what can happen in these events. And I can send that out. And again, an explanation of what service design is. But I think the main hook would be, I read about this thing, I've heard about this thing, I've been in this webinar. I want to see how it's done. I want to be able to do it and see how it's done. All right, show up. Yeah. So I can send that out.
Okay. Good luck, Michelle.
Yeah. This is the
I hope it's not
second.
real.
Yeah, this is the second fire alarm call I've had where somebody had to leave because of fire alarm in 2 days. So
Okay, it's fire alarm testing season,
I
maybe.
think so, yeah.
Yeah.
All right. Any other questions?
How about I'm gonna go back to the hub space team and see, are you guys planning, or somebody planning from your team to come along?
We were just negotiating that right now.
Okay, well, I'll let you get back to that.
Yeah, I think it would be really valuable. We'd love to participate and actually have an opportunity to be guided through the process. You know, we're like, oh, that's a long weekend. Oh, could we shut the office down? Should we all attend? We won't be working together. These are the things, right? So yeah, we've always been intrigued. Just now we have the hands to actually participate a bit more, Pamela. That's the lovely part of
Yeah.
a growing hub space.
Yeah. And November, it's a lovely time to be in Prince George. That's why I come March and November.
That's
Is the weather in Finland really that bad?
Well, when I was there in Prince George in March, it was -26, so it was certainly warmer when I came back here. Yes. Yeah. But yeah. November here is very dark because of course the southernmost part of the country is basically the BC Yukon border. So that's where I live. So it gets very dark, and November is a great time to leave, but usually for somewhere sunny. But otherwise, so I haven't heard much from the male attendees. I would like to hear some diversity happening here.
Hi, Pamela. Thank you so much for that presentation. Yeah, Northern Development provides grants to Indigenous governments, local governments. That process is the program requirements, gathering information, applying, and then reporting, and then follow-up reporting. And so at times there's this cooling off period and we receive an application because there's been changeover, and they're not actually through the cooling off period. So that time spent applying is wasted, or government relies on these grants year after year to provide community infrastructure. And so, yeah, I think the service design, in order to make the grant process and the reporting process, the follow-up process, is very applicable for our organizations. So definitely interested in having this discussion with our team, especially at a time when we transition to new software in order to deliver grants. And so, yeah, it's also an intimidating process, or the idea of figuring out how to offer we offer many different types of programs or grants that appeal to a very wide audience, for-profit businesses, not-for-profit businesses, wholly owned Indigenous corporations, local governments. And so trying to empathize and learn your audience. I guess one of my questions was, do you see AI as being part of a service design in order to learn faster about your audience? And are there cases in Europe where AI is being integrated into service design so you can learn what the problems are faster, and how is that being done?
That is a topical question. It is something that we as service designers are discussing. In early October, we have the Global Service Design Conference happening here in Helsinki. And that is definitely, you know, on the top, one of the topics, because the question is, as I said, the mindset is human-centered design. If you're asking AI, it is not human. It does not experience, and it can only give you what's been input. So if the data that has been input is biased, is missing, has big gaps, then what you get out of it will also be missing, have big gaps, but you'll think that what you have is the right answer. So this is a huge discussion right now. is can you use AI for human-centered design? I would fall on the side of absolutely not. But I am not the, I'm not any specific authority on that. Others will have other opinions on that. But, seeing the gaps in data, especially when you are in minority groups, when you are in kind of like all of the, if you're already being kind of like not taken into consideration, it will amplify that. So there may be parts of the process that you can do that with, but I would say that you would always have to verify with your own research anyway. I'm just trying to find the book. Maybe I don't have it right here because I bought the book, but unfortunately, oh, this one. Here, it's called, it's this Invisible Women. And I have the book, but the book makes me so mad I have to like walk away. So I actually got the Audible book so that I can go walking and listen to the book at the same time, and then just turn it off when I can't take it anymore. But basically it's about looking at the bias in data. And the focus here is through gender. And so even just listening to that and thinking about AI and the data that's inside of it scares me. So, when you're working with Indigenous communities and these kinds of things, I think it's it's difficult to rely on things like AI for those experiences.
Yeah, absolutely. And who's designing that AI has a massive impact on who it's being applied to. So yeah, I definitely was just curious. So thank you for that response. And I believe in the human-centered approach, but potentially AI providing insights into that data we never see as to where are people abandoning in the process that we don't see, or they're unwilling to share that information.
Yeah.
So
if you want to use AI for the information that you input and have, so like if I had a ton of transcripts from interviews that I've done, right? And I wanted to input that into AI and say, can you give me the top 5 problems from that? I think that would be a useful use for it. But if you're going to just type in, give me the top 5 problems that this group of people is having for this thing, right? You're going to get what other people have put in there. But if you're putting in data of your own and just asking it to sort it, then that might be more useful way to use AI to help you with your process.
okay, thank you. I appreciate you discussing this with me.
Yeah.
Any other thoughts?
All right.
Well, thank you very much, Pamela. It was
Yeah,
great.
I'm happy. If you want to ask, like, just email me with questions or follow-ups or anything, feel free to do that. I will create a PDF of this presentation and I will get it. I'm not sure, Kafui, do you have